Lustral, Sertraline, an antidepressant medication, is commonly used to treat conditions such as depression, anxiety disorders, obsessive-compulsive disorder, OCD, panic disorder, and post-traumatic stress disorder, PTSD. However, before using this medication, users may have various questions. Here are some frequently asked questions. 1. Does Lustral cause weight gain? The effects of Lustral on appetite vary from person to person. Some users experience weight gain, while others may lose appetite. It cannot be said that the drug directly causes weight gain. However, some side effects such as increased or decreased appetite may lead to weight changes. 2. Can alcohol be consumed while taking Lustral? Alcohol can increase side effects when used with Lustral. Alcohol may intensify the drug's effects, leading to symptoms like dizziness and drowsiness. Therefore, it is recommended to avoid alcohol while taking Lustral. 3. Does Lustral cause suicidal thoughts? Suicidal thoughts may occur during the use of Lustral, especially in young adults. If a user starts experiencing suicidal thoughts due to the medication, they should immediately consult a doctor. 4. Is Lustral used for a lifetime? Antidepressant medications like Lustral can be used for long-term treatment of certain mental disorders. However, treatment duration varies based on individual needs and is generally determined under a doctor's guidance. Lifetime use is not necessary. Some patients may discontinue treatment periodically. 5. Does Lustral cause addiction? Lustral is not an addictive medication. However, some individuals may experience withdrawal symptoms when stopping the drug. Therefore, it is recommended to gradually reduce the dosage under a doctor's guidance. 6. How long does it take for Lustral to work? The time it takes for Lustral to take effect can vary from person to person. Generally, some improvements can be seen within 1 to 2 weeks, while full effects may take 4 to 6 weeks. Patience and regular use are important. 7. What medications interact with Lustral? Lustral can interact with certain medications, especially when used with other antidepressants, painkillers, and sleep medications. Side effects may increase. It is crucial for the doctor to know all medications being taken. 8. Does Lustral cause insomnia? Some users may experience sleep problems while using Lustral. However, this effect varies from person to person. If sleep disorders become severe, consulting a doctor is recommended. 9. Can Lustral be used during pregnancy and breastfeeding? The use of Lustral during pregnancy and breastfeeding should only be done with doctor's approval. During pregnancy, the effects of the medication on the fetus should be carefully evaluated. 10. Can Lustral cause low blood pressure? In some users, Lustral may lead to low blood pressure. This can result in symptoms like dizziness, fatigue, and lightheadedness. If these occur, it is important to follow the doctor's advice. 11. Can Lustral lead to decreased libido? Yes, Lustral, Sertraline, can cause side effects such as reduced libido and sexual dysfunction. Some individuals may experience these effects, and it is advisable to consult a doctor about adjusting the dosage or exploring alternative treatments. Make sure to like the video and subscribe to stay updated on more helpful content. Your support helps us bring you the best information. Thanks for watching.